topic because the next topic of discussion is actually brought to you from the Philippines, the country which is rich in culture and diversity, biodiversity. So that is the reason why I feel very much excited to present to all of you that the next topic, the status, the challenges, and the future directions of pharmacogenomics in the Philippines. And we are having the representative from the University of the Philippines, Dr. Francis Capold, with us here, ladies and gentlemen.
A good day, everyone. Sawadika. Before I start my short presentation, I would like to extend my sincerest gratitude to the organizing committee for inviting me to speak on PGX in the Philippines, status, challenges, and future directions. I'm Francis Capule from the Philippines. The primary objective of my short presentation is to give you an update on pharmacogenomics and pharmacogenetics in our country. First, let me give you a short introduction about the Philippines. The Philippines is a diverse country in terms of geography, people, language, and culture. One of the possible reasons for its diversity is the influences from different parts of Asia Pacific region. At present, the Philippines is home for over 170 Filipino ethno-linguistic groups based on language and culture. Among these groups, Tagalog, where I belong, is the ethno-linguistic group with the highest population in the Philippines. Aside from having a complex genetic history, the Philippines also has a complex population genetic structure composed of homogeneous regional centered groups and heterogeneous ethno-linguistic groups. Several studies on Philippine population genetics show that regional center and ethno-linguistic groups are closely related to our neighboring countries, such as Taiwan, and Southeast Asian groups as compared to other Asia Pacific groups. 2 years ago, as we remember, the Southeast Asian Pharmacogenomic Research Network, or simply CPHARM, and its member countries, including the Philippines, did a situational analysis of the status of PGX implementation in our region. Here we have identified the key elements needed for the full implementation of PGX in the region, namely structured PGX education, pharmacovigilance and ADR reporting systems, laboratory facilities for both research and clinical use, as well as researches on PGX and economics in general. So these key elements were used to assess the status of PGX implementation in each member country. And based on this figure, as we can see, the Philippines is lacking one key element, and that is economic research. Here are the underlying barriers and concerns related to PGX implementation in more than half of the CFAR member countries, including the Philippines. The major barriers include lack of PGX research funding, lack of experts or clinicians with experience in PGX research and practice, insufficient facility or infrastructure to support PGX research or service, lack of national policy or guideline for PGX testing, lack of HTA or health technology assessment, and lack of awareness for PGX. On the other hand, major concerns include sustainability of research funding, uncertainty of economic situation in the country, lack of PGX awareness, as well as limited access to PGX data or medical records. As we remember, one of the major concerns and barriers I just mentioned is the lack of funding, okay, for PGX research and sustainability of funding for this kind of research. In the Philippines, the DOST, or the Department of Science and Technology, provides financial support or research funding to those research projects that are in line with the harmonized national research and development agenda for the period of 2017 up to 2022. Based on this figure, one of the R&D priority areas and programs is the health program, under which it includes omic technologies for health, with the ultimate vision to develop local technologies for personalized medicines, diagnostics, and therapeutics as support to health and clinical practice guidelines and policies. The research priorities for 2019 to 2020 include omic technologies for health and wellness, bioinformatics and system biology, novel technologies for therapeutics, biobanking, data mining, and population studies for human health, ethnicity, and forensic applications. Furthermore, the National Unified Health Research Agenda for the period of 2017 to 2022 has 6 themes comprising research priorities, including global competitiveness and innovation in health. Under this umbrella, it includes omic technologies. Omics, for health research and development, envisions the adoption of research-based innovations, practices, and policies towards a healthy Philippine nation. In terms of facilities, the University of the Philippines, or UP, Philippine General Hospital, or PGH, Philippine Genome Center, National Institute of Health, University of the Philippines, Manila, or simply NIH Philippines. So these institutions, they are spearheading research, capacity building, and institutional linkages for the development of genome-based applications in the Philippines. Let's first discuss the UP-PGH. The Philippine General Hospital is one of the major players of the precision medicine initiatives, with focus on the top causes of mortality and morbidity in our country, such as cardiovascular diseases, diabetes, and cancer. In 2019, or last year, the first cancer phenome biobank in the country was inaugurated. Its vision is to provide quality and standardized biospecimens for biomedical researchers directed towards the advancement of precision medicine in the Philippines. Next is the PGC, or the Philippine Genome Center. PGC, or Philippine Genome Center, is a genomics focused multidisciplinary research unit of the state university in our country, that is the University of the Philippine System, or simply UP. One of the research and development programs of the Philippine Genome Center is the health program. The health program utilizes genomic researches in order to develop diagnostic kits for early diagnosis and treatment of both communicable and non-communicable diseases, expand biogenomic surveillance, strategic biogenomic surveillance and forecasting system in the Philippines, identify drug-resistant strains and new strains during epidemics and outbreaks, and lastly, advanced pharmacogenomics. Here are some of the research projects of the health program of the Philippine Genome Center. As we can see, we focus on cardiovascular diseases and diabetes. Another key player in the implementation of the precision medicine initiatives is the National Institute of Health under the University of the Philippines, Manila, or simply the NIH Philippines. It is also involved in another initiative, and that is the Future Thinking Initiative in Healthcare. Here are the precision medicines initiatives. They include the Genomic Surveillance Program, Cardiovascular Genomics Program, Cancer Genomics Program, and lastly, we have the Filipinome, or the Filipino Genome Project. The succeeding slides were obtained from the University of the Philippines, Manila study groups. Thank you very much to Dr. Eva Puchonco de la Paz, the NIH Philippines Executive Director, for sharing these succeeding slides with me for this presentation. So let's start with the genomic surveillance program. During infectious disease outbreak, whole genome sequencing can help us first to understand the transmission of the virus by examining the changes in the genetic sequence of the viral DNA genome obtained from different patients. Second, a better understanding of the viral DNA sequence will assist in designing therapies and vaccines that target specific features of the virus. Third, continually tracking the virus will alert the researchers of the genetic changes that might give rise to a less virulent or more virulent strain. And lastly, to prepare for future pandemics. So the experiences that we gain now will be highly informative and useful when responding to future pandemics in the most effective and efficient manner possible. Next is the cardiovascular genomics program. In previous years, the Department of Science and Technology, or DOST, supports research projects on disease detection, risk assessment, and drug response using genomic and molecular technologies, with focus on non-communicable diseases such as cardiovascular diseases, diabetes, as well as lung and colorectal cancer. In particular, for this cardiovascular genomics program, a percentage of genetic variations found in published literature are not present in the Filipino participants of the program, highlighting the importance of or role of ethnicity in predicting drug response to cardiovascular medications. Genomic databases for heart disease and diabetes specific for the Filipinos are now being built to make the clinical practice more precise and personal. So this initiative is funded by the Department of Science and Technology. So with the data that we now have, we will be able to give the right drug at the right dose for the right Filipino. So this initiative is in line with the initiative of the Department of Science and Technology, and that is Saktong Lunas para sa Saktong Pinoy. Or in English, it may be translated into precision medicine for the Filipinos. A similar program for cancer care has been developed to make genetic testing uh, available, accessible, and affordable to every Filipino. And lastly, we have the Filipinum or the Filipino Genome Project. Unfortunately, Filipinos are poorly represented in existing public genomic reference sequence. The whole country will be engaged in this big project. This project or initiative targets to sequence 7,641 Filipino genomes, okay, from representing different islands in the country to create a national Filipino reference sequence. In addition, here are my ongoing researches related to pharmacogenomics and pharmacogenetics, one of which is the resequencing project of Southeast Asians using the 100 pharmacogene next generation sequencing or NGS panel. The principal investigator of this big project is Dr. Wasan Chandrapita from Thailand. The Philippine research team is composed of yours truly being the principal investigator in the Philippines. Together with me to implement this project in the Philippines are Dr. Silao and Dr. Nivado from the NIH Philippines. The other co-investigators are seen in this picture of our last CFARM meeting held in Indonesia last year. The big project has, as we all know, has future sub-projects including pharmacogenomics of scars or severe cutaneous adverse drug reactions and DDs or drug-induced liver injuries. Other sub-projects include pharmacoeconomic evaluation of pharmacogenes variants in the region, pharmacogenes assay development in settings, and lastly, we have the application of pharmacogenomics in clinical pharmacy practice. Another study of mine is this, investigating the association between the HLA alleles and carbamazepine-induced SJS and PET. Here are my local and international collaborators for this project. Preliminary findings have already been published. One of our publication is this case report in the BMJ case report. Here we reported a case of a Filipino patient with carbamazepine-induced SGSN10 overlap. The patient tested positive for both HLA-B75 serotype and HLA-B star 1521 allele, while he tested negative for the common HLA-B star 1502 biomarker. Another publication is this. Here, we concluded that the HLA-B75 serotype and HLA-B1521 were significantly associated with carbamazepine-induced SGSN10. Therefore, the HLA-B75 serotype or HLA-B star 1521 allele may be used as a genetic risk assessment prior to prescribing in order to prevent carbamazepine-induced SGSN10 in Filipino patients. Like what I've said earlier, the NIH Philippines is also involved in the future thinking initiatives on healthcare. These initiatives include cutting-edge research on AI or artificial intelligence, vaccine and drug discovery and development, genomics, proteomics, and metabolomics, biomedical device research closely linked to patient care services and clinical trials. They also include health sciences education to integrate translational research and innovation in the delivery of health services. Speaking of education, the University of the Philippines, Manila, in particular the College of Medicine, offers a dual degree course on molecular medicine. Graduate of this course will have the necessary expertise for conducting biomedical researches in vision to upgrade the existing healthcare services in the Philippines. So based on the results of the situational analysis I presented earlier, as we recall, the Philippines is lacking economic researches. The Philippines is also lacking HTA or health technology assessment. So an important update in this area is the establishment of HTA unit or health technology assessment unit in the Department of Health in our country. So the primary objective of having this kind of unit in the Department of Health in our country is to provide technical on the optimal use of health technologies in the pursuit of universal health care in the Philippines. So before I finally end my short presentation, I would like to thank the following local and international collaborators and colleagues. As well as these institutions, these funding agencies for supporting my ongoing researches related to pharmacogenomics and pharmacogenetics. So with this, I finally end my presentation. Thank you very much for your kind attention. Should you have any questions or concerns, so please feel free to contact me at frkapule@up.edu.ph. So again, thank you very much. Pukun Maka, and have a